Hello, my name is Thomas Schopf, and I work at the University Hospital of North Norway. And my topic is going to be e-health in Norway. Let me also thank the organizers for having me on the conference. I'm a partner of the Norwegian teledermatology provider Askin. Now here you can see where Norway is located on the globe, and especially Tromsø. We have 5.4 million inhabitants, and the area is about 385,000 square kilometers. Here you can see Tromsø and the brown building complex here, that's the University Hospital. The black building here is a research center, and here is also the Norwegian Center for e-health research located. The center was previously called the Norwegian Center for Telemedicine. I also hold two clinical positions. I run a small private dermatology practice, and I'm also a doctor here at the Regional Center for Asthma, Allergy, and Hypersensitivity. Now, in Norway, we spend about 390 billion Norwegian krona, and most of that is spent within the public sector. A typical Norwegian patient would first go to the GP's office, and then, if there's a need for that, he or she can be referred to a specialist center. You can also go directly to a specialist, but that would be in the private sector and not in the public healthcare system. Already in the late 1980s, we had some experiments in Tromsø running some video conferencing services. And in the beginning of the 1990s, a regular teledermatology video service was established. So in the 1990s, we will look at video conferences, the emergence of the digital cameras, and of course the mobile phones. So on the left picture, you can see how making a phone call maybe was in the 60s and 70s, and of course also partly in the 1980s. And then during the 1990s, you have the rapid evolvement of smaller and smaller mobile phones. This must be one of the very first, or actually I think it is the very first paper about teledermatology in Norway. It was about a pilot trial which was done already in 1989. And a few years later, the teledermatology video conferencing service in Tromsø was established as a routine service. And the reason why Tromsø was central in Norway at that time is, you can see here, because it's simply because of the great distances, and the people are living on many small places, and there are some great distances. I put the map of Austria on top, so you will get an idea that these two counties of Norway, they have the same size as roughly like Austria, but we have only very few hospitals. We have one here in Harstad, we have Tromsø, then we have Hammerfest here, and we have Kirkenes here. So the video conferences in teledermatology, they were established with Hammerfest here and Kirkenes. In all this northern county, there was actually no residing dermatologists here. So if people would come to a physical examination, they would have to travel that distance all to Tromsø. In addition to teledermatology, there were also some services connecting GP offices, and also the hospital in Spitsbergen in the city or the town of Longyearbyen. This is from an exercise dealing with an emergency case in Spitsbergen, actually. And this service was mainly used for emergency cases. Then in the 2000s, we had the introduction of the iPhone smartphone and other smartphones. The concept of store and forward consultations, the term apps was coming, and social media, and also e-learning. During that period, we still had the service with teledermatology, and at the Department of Dermatology, there was also a pilot trial using store and forward telemedicine. But somehow the doctors in Tromsø, they enjoyed the video conferencing much more. They were used to that at this time. They had been using that maybe already for 10 years. So the store and forward concept really didn't really become popular with the North Norwegian dermatologists, and neither did it in the southern regions. Also during this time, the telemedicine and teledermatology conferences came up, and I remember the very first one in Graz, the first World Congress of Teledermatology, which I attended, which was an amazing experience. And I imagine that suddenly in the breaks, a guy came to me and asked if I was from Tromsø, and he said he knew that city very well. And That was actually Leonard Whitcomb, and I was even more amazed that somebody knew about Tromsø. Also in that time, the image quality and the lenses for dermoscopy became so good that now was the time for using teledermatology. This is an image from Amanda's service in New Zealand. And also here we have a web-based course on dermoscopy, which was created by the colleagues in Graz. And I also attended one of the first versions, I think, of that course, which I really, really enjoyed. And there are several websites, most of them you know, the lvh.no, that's a Norwegian site for general practitioners. Now, the 2010s, what happens? Well, the smartphones, they're getting better and better. App is becoming word of the year in the US. We have still social media. We have now more and more developments and research within artificial intelligence, not only in medicine. We have the concept of personalized care. And we all know, though, this image about Steve Jobs presenting one of those new iPhones. And from being just a simple phone, the mobile phones now, the smartphones, have turned into real full kind of computers that can provide you with any service you want. And during the 2010s, there was a lot of research in Norway trying to find out why isn't telemedicine being more used in this country. And we had only a few services. We had the teledermatology service. We had, during the late 2010s, there was coming up a service, an online portal where patients could send messages to their GPs. But altogether, the volume was really not very high. And my colleagues, we were thinking, what are the barriers here? Because I mean, we have the equipment. Part of the solution or part of the problem was explained by this guy who is a politician, and he asked the health minister about reimbursements. Why don't we reimburse the use of telemedicine more? And I think that's one of the big problems in that period, that was simply too time consuming to start doing telemedicine. At the same time, you wouldn't get really good reimbursement. This is a paper from a colleague of mine, a doctor. He's an anesthesiologist, Stein Roald Bolle. He did a thesis during the 2010s, and he was investigating how you could use video calls to assist the public when they run into a case of cardiac arrest. This is from the company where I'm a partner, and I think during that time, many or several new teledermatology companies were founded with. I think there was a shift in generation. There were coming younger doctors who had completely different ideas about telemedicine and what it could do. And here's an example. They developed a small lens to use for teledermoscopy services. And the idea was that this lens should be much cheaper than the commercial products you already have out there, which can be quite expensive. Now in 2020, as you all know, we had this ugly thing, the COVID pandemic. And this turned out to be a game changer in healthcare in Norway. Also an example from the world here, you can see a priest using a smartphone to broadcast his service because nobody can come to the church. So we see all sorts of emerging new use of video equipment and smartphones. Here also right after the lockdown, the Norwegian authorities encouraged medical personnel to use more telemedicine and distance counseling. And here actually they even suggested for dentists to use it whenever they could. So it's hard to imagine that you could treat somebody who is not there, but you can do preventive care services or simple follow-up services. So now it was the focus, let's use telemedicine in Norway. This is also from the Norwegian Directorate of Health. It shows the statistics about use of e-consultations, and that is both the video consultations and also text-based services. And you see there's a steep rise here right after the lockdown. The lockdown in Norway was I think it started the 13th March 2020. So after that, suddenly we have a big rise here in the use of telemedicine services. This is another figure here. This is about how it's stratified into the regions of Norway. And interestingly, even the rural areas, you see this blue line here, that's Oslo. Even in cities, they were really embracing telemedicine now. Now I will report on a specific survey. This is very interesting. It was done by a couple of colleagues from NSE. And this was planned way before the pandemic and the lockdown situation, but by coincidence, when they did the survey, it was just after the lockdown had started. And they were investigating the use of video consultations in private practice in Norway. So it was performed, started in April, and during that time, all GP offices had very strict rules before people could enter the office. They had to make a phone call first, and then there was done a triage. How is it really important that somebody would enter the office, and if not, they would try to do everything by using remote consultations. So here they were in this survey. They were asked to monitor a random day when they had video consultations, and they were asked a couple of questions about that, and 1,237 GPs participated. In Norway, the total number of GPs is about 4,500. And already then, 81% they already had video equipment installed, but 80% said they had no prior experience with using video consultations. And on average, there were 3.8 video consultations per GP in that survey reported. And they did 35% of their consultations on that random day via face-to-face consultations. 27% they did on video consultations. E-consultations, which are the text-based message systems, were 17%, and usual phone calls were 23%. And they said also that 51% of the GPs, they considered that video consultations, they were similar or even better suited for the problem than face-to-face consultations. Regarding the use in dermatology, it was a little less suitable as reported by the GPs. In 15%, they were concerned that serious illness might have been missed. But here we have to say that they were using this also for triage, so they would also consider acute chest pain, for instance, to be first on video to get an idea of what this was about. Almost 50% said they would consider to use video consultations for a similar problem also after the pandemic. So this was a kind of jumpstart for video consultations, which many or most of the GPs hadn't been using, even if the equipment was already there. What's next? Well, we are now in the 2020s, and of course we need to get rid of COVID-19, this ugly thing. And I think the only really thing that is going to work is to get all the population vaccinated. And for Norway, we can say the remote consultations are here to stay. During the corona pandemic or the beginning of the pandemic, the authorities suddenly, and also the politicians, they suddenly increased the reimbursement. So they really realized that this is an important tool in the pandemic. Then, of course, still to come, the personalized care is important. We have to focus on vulnerable groups. The digital divide is still there, with elderly people being not so proficient in using digital tools. We have the social media still being important in this decade, I think. And of course, also artificial intelligence will really be playing a major role. So I think telemedicine in Norway, to sum up, I think it has been like the Sleeping Beauty. She's been there for a long time, but nobody cared about her. And suddenly you have like Prince COVID coming and kissing her awake. So I'm optimistic for the future. I just hope that Prince COVID will disappear, and hopefully the princess won't get a relapse. Thank you.